Mike Merson, head of the Global Health Institute. I want to welcome you. Primarily what I want to do in this session is welcome you and introduce Victor Zhao and Peter Piot. There are some important people here, members of our board of advisors, Tom Gorey, Jack Leslie, Chris Elias, Pop Guy, Dave Gendell, Christine McKenna, and Peter himself. There are some members here of the International Partnership for Innovative Healthcare Delivery, which is a new initiative that the Chancellor has started, and we will soon be joined. He and I were just dealing with the media upstairs with Richard Besser from ABC News. I just spent lunchtime with him. He gave a magnificent talk over in the pediatrics lunch, those of you who joined in the new announcement of the pediatric division of global health, and he's a great spokesperson for health with all his years at CDC. And of course, I want to thank the many people, students and faculty and staff, friends who made this event and this evening happen. Now here's what I'm told to tell you, although I have to tell you I don't know what it means, but that I encourage you to join the conversation on Twitter, okay, using the hashtag, ready? I guess, DGHI5YR. Is that right? Did I get it right? Okay. Number's right. Okay. So a little bit of history. You know, the Institute started about 5 years ago when there was a committee formed by the Chancellor and the Provost. And there were 100 faculty involved. Many faculty were involved in global health research. Many more wanted to be involved. And of course, there were increasing groundswell from undergraduates in particular, most of whom had been inspired by a course or a faculty member for the university to provide them opportunities to learn more about health challenges in the world. Bart Haynes and Bob Cook-Deegan chaired that committee. They issued a report, like all good committees do. In June of 2005, I imagine many of the faculty who were here at the time were spoken to, and that led to the creation of the Institute. That report was in 2005. The Institute was created in 2006 with a mission to reduce health disparities in our local community and worldwide, and that's important, in our local community and worldwide. It was to truly span the humanities, social sciences, engineering, environment, law, and divinity, as well as the life sciences, meant to be a global institute, but also in terms of our university. There you are, Victor, good. It was also meant to be a real university institute that would involve the medical center. And what I can say is what that report did is that it really did listen to the call from students for more engagement and the desire of faculty for greater involvement. Now, it's a funny story. I was actually sitting in a hotel room in Kampala, Uganda, when I got a phone call from Bart Haynes asking me, I was on an IOM evaluation of PEPFAR, asking me if I might be interested in coming to look at Duke. And I don't know if I should say what I knew about Duke, of course, was the basketball team. But I knew about Victor, and I knew about a number of the leading faculty down here that had been doing very exciting work, particularly in Africa. And I was intrigued, and then 6 months later, I can't tell you how excited I was by the collegiality and opportunities that are so special about this university that I joined. And of course, what happened was, initially, I found myself sitting in a small office in the basement of Trent with a box of pencils, eager to learn from Ralph Corey, Kate Wetton, John Bartlett, and many others how to organize this institute. Now, I actually brought my pencils from home, as none of the administrative offices at Duke had a clue what the Global Health Institute was. And so we would ask for computer paper, printer cartridges, and pens, and it just fell on deaf ears for about 2 weeks. So you should know when you start something up, be patient. Now, since that time, I've been incredibly fortunate to be part of a dedicated team that's built the Institute, and I hope we've realized what that steering committee wrote. As you'll hear throughout the day, we span the campus and medical center. We have over 100 faculty working now with the Institute, 25 of them recruited just in the past 4 years. We've established a dozen education and training programs in Durham and globally that attract students and trainees from all over the world from a wide range of disciplines and life experiences. Whether at the undergraduate, graduate, or professional level, these programs encourage participants to intellectually and experientially engage with the most pressing global health problems. We have a robust and growing research portfolio, which you will soon hear about, and partnerships that I think are really real with a number of premier universities and organizations around the world. And I have one slide on that. If you could put the slide up. No, the next slide. Okay. I'll come back to the previous slide in a minute. This map depicts the many different partnerships we have around the world. The thing I want to mention more than anything else is these are not dots on a map, but they illustrate true and lasting partnerships that include a shared vision, common priorities, and an understanding of and respect for each other's cultures. And we have a few of our good friends here in the audience from Moshi and from China, which you'll hear about in the conference. Now, there's a summary of our achievements in the last 5 years for those of you who are interested in this book that's in the room. It's a timeline with some of the achievements that we've had. Now, a few days ago, I met with our Institute Student Council. Now, I'm always a little nervous to meet with students. And now you can put the next slide on. As I can never forget the welcoming I received from our Chronicle when it published an editorial only 13 days after I arrived at Duke, warning me, as you see here, that I best prioritize student involvement in the work of the Institute. Now, what I did when this came is when I saw this article, I emailed the provost and I said, "What is this?" And he said, "Welcome to Duke." I can tell you that the meeting with our students went very well, and I was reminded again that our students provide the energy and passion to keep us striving beyond what we think is possible. And their motivation to make a difference is the driving force behind what we are accomplishing. I think all of the faculty in here and at the Institute would agree with that. I have no doubt that if we equip our students with the knowledge, resources, and skills to change the world, our world will be a healthier, more peaceful place. So where will we be 10 years from today, which is what this symposium is about? I can imagine innovative and interactive global health learning environments using the latest technology to bring together students in Durham, India, Tanzania, and China in a common global health curriculum and dialogue. I am optimistic that the results of our research will save and improve the lives of many of those who, for one reason or another, are more likely to face premature death and illness. And I foresee our collaborations with partners in low and middle income countries increasingly giving our and their students and faculty the opportunity to explore creative solutions to existing and emerging challenges. It is the potential of what lies ahead that is exciting and ambitious, and this is the theme of our symposium today. Those are my opening words. I now will have the pleasure of introducing Victor Zhao. Before we start our program, I invited him, and he graciously agreed to say a few words. Victor, really, I would say, is certainly one of the true early champions of global health at Duke. He was appointed Chancellor for Health Affairs here and President and CEO of the University Health System in July of 2004. Before coming to Duke, Victor was Chairman of the Department of Medicine at Brigham and Women's Hospital and Physician-in-Chief at Brigham and Women's Hospital in Boston. Prior to this, he was the Arthur Bloomfield Professor and Chairman of the Department of Medicine at Stanford University. He's a well-known, renowned cardiologist whose academic interests are in cardiovascular, translational research, and mission-based education, and he's been appointed here as the James Duke Professor of Medicine. He received his MD degree from McGill University and had his postgraduate training at Harvard, but most interesting and relevant to us, he was born in Shanghai and was raised in Hong Kong. And no doubt Victor's personal history explains his global outlook and makes him an outstanding leader for Duke Medicine. In short, Victor is one of the reasons we are sitting here today. Quite simply, he has extraordinary drive and passion for addressing health disparities in the world, including right here in Durham. We can all be grateful for his wise vision and continued support. Victor?
Well, good afternoon, and thank you, Mike, First, I want to welcome Peter Peart, who, as you know, is to me Mr. Global Health, and being able to spend the time with us today. It's very much appreciated. And also the chairman of my board of health system, the board of directors, Tom Gorey, who's here today as well, and so many of you. I want to welcome you to this very momentous occasion, the 5th anniversary of the Global Health Institute. When I look at where Duke Global Health Institute is today and all that is accomplished, you saw the map with lots of dots, but in that dot, every one of those dots is a meaningful relationship, someone's being helped, some education programs will move forward, and so on and so forth. You know, I mean, the kind of work you've been doing, strengthening education in Tanzania, developing third-year global health study program that placed dozens of medical students all over the world, and most recently launching of the Global Health Division within the Department of Pediatrics. So when I look at where Global Health Institute is today, I can't help but reflect on the journey that led to today's celebration. At Duke, addressing health inequalities locally and globally has always been a core mission and passion of the entire institution across all schools and all disciplines. So the path from concept to reality, that is the creation of the Duke Global Health Institute, has been a collaborative effort engaging large numbers of faculty, students, and staff. And many of you are here today. But for each one of us, myself included, it is also the realization of a personal journey. Eliminating health disparities among underrepresented populations and socioeconomically challenged populations have been a lifelong passion of many of you and certainly of mine. Ever since I was a child, post-war China, when I observed poverty, health disparities, this has always been something I would like to see us address. So when I was at Harvard, I had the great opportunity to work with Paul Farmer. He was a member of my department, and together we created a division, then called Social Medicine and Health Inequalities, which is now called Global Health Equity. And really, a lot of great things have been happening there at Harvard, at Duke, and everywhere else. So really the idea of creating such a division was principally to create an academic program that can allow research, training, education, but most importantly, career pathways for those who want to devote their life to global health. That was not actually a common thing those days, and not even now, possibly. A lot of people are passionate about this, but find their own spare time to do this, or now maybe the night job or day job. But I think the ability to say this is important for an organization, an education institution, this is important for a medical center, this is important for a business school, this is important for all of us, that we want to support you, and this is rewarded and recognized as a principal pathway of a career in people in medicine, in business, in law, or in policy. I think this is the statement we want to make. And to date, Paul's division has over 60 faculty members, all recruited by him, and develop a real pipeline of leaders. So the story at Duke is really very similar, because in 2004, when I first came to Duke, it was a time when already there was a lot of activity and momentum on global health at Duke. And certainly I had the pleasure of meeting Kate Wetton, Bart Haynes, so many of you here that I can't mention everybody's name, but many of the people are already working so passionately around this area. And of course, that particular year, 1,500 freshman students were assigned to read the book Mountain Beyond Mountains. And Paul came to campus, and the momentum was palpable. And so it became very obvious when I said to President Broadhead, in our first year, what is our signature initiative? I say, it's got to be global health. And I had a most receptive partner in the President Broadhead. And two of us charged, as you heard, a global health steering committee with the help of Provost Lang, and asked him to look, what should it look like at Duke? what should global health look like at Duke? They came back and say we ought to have a university-wide institute. That's a little different than what has been in the past because in many places, global health is either the School of Public Health, the medical center, but not broadly, embracing every discipline. And obviously, the thinking behind this is so compelling. So we asked Bart Haynes and Bob Cook-Deegan to lead this committee, who then came back and said, we also need $30 million and a great leader. So I had a good partner. So President Broughton and I split those $30 million, and we are so happy to see this institution doing so well. And I know it's sustainable and doing great things going forward. So it's really exciting and humbling to see what was a concept is now a thriving institute whose mission is to understand and address health inequalities throughout the world. Of course, equally impressive has been the multidisciplinary approach that Institute has used to carry out education, research, service, and policy projects, not only in this country, but also in many places you heard about, Malawi, China, Tanzania, Bolivia, to name a few. You all know that an institute like this doesn't become a world-class institution unless you have a world-class leader. And so in that way, we were incredibly lucky to recruit Mike Merson. And I still remember the day I was arrived at Aspen for an Aspen Institute meeting. I was on the phone trying to convince Mike that he should come. And I think we might have worked out at least a principle, a green principle, and we're so glad he's here. And you know the things that he's done, and you just have to look at yourself and to see what a great accomplishment and what a great leader he has been. So even though that Global Health Institute has already accomplished a lot, and in many ways, however, it's just the beginning. One of the most significant added values of an institute such as this, being located at a university such as Duke, is the unprecedented human capital. We are in the position of having world-class experts as well as developing future experts and leaders, where knowledge is not only created but shared, but more importantly, where it can be applied for the human good. Therefore, I encourage each one of you, students, trainees, faculty, and everyone, to immerse yourself in this great opportunity addressing global health inequalities and to become a difference maker. It's interesting, when I look back in 2006, I was quoted, I made this comment, and I feel the same way today, it was then. And I quote, "For an organization like ours, it's not good enough to say we're going to give the best care to everyone who walks through our doors. It is not good enough to say we're going to do outstanding research. We need to transform medicine and healthcare and eliminate health inequalities. And we have the obligation and the potential to do just that." Thank you very much.
Thank you, Victor, for your wonderful comments. Now on to the symposium. So the purpose of today's symposium, I mean this sincerely, is not to pat ourselves on the back for a job well done. It's to recognize the contributions of our faculty and university are making to some of the most critical health issues at our time, and to renew ourselves to a common mission of bringing about meaningful, lasting change in the health of populations around the world. Now, Victor will remember that a symposium similar to this one was held 5.5 years ago in the Nasher Auditorium to launch the Institute. It's interesting looking at the agenda of that meeting. It very much focused on HIV/AIDS and other infectious diseases. Well, today's leading killers and the future's leading killers look quite different. The shift we are seeing now in most part of the world is due to worldwide economic growth, movement in urban areas, and people around the world living longer, more sedentary lives. Last week marked an important turning point, we hope, for global health. The UN General Assembly put non-communicable diseases like diabetes, obesity, heart disease, and cancer much higher on the global agenda. These diseases claim 36 million lives a year, But what is interesting is that 80% of these deaths occur in low and middle income countries. Non-communicable diseases are the largest killer globally and require a much greater global response. Second, of course, to these chronic diseases is the effect of the environment on health. 24% of the global disease burden can be attributed to the environment. 1.2 billion people lack access to water. And third, health outcomes depend on health systems, which require effective policies and leadership, financing, workforce, the right policies, and I almost showed a slide about how to do it and how not to do it. But I think the main thing we know now is that no matter what interventions we have, if we don't have a health system, we can't deliver and deliver care and prevent disease. So non-communicable diseases, global environmental health, and health systems, these are areas where Duke has considerable strength added to our expertise in infectious diseases. And the Global Health Institute is prepared to recruit more faculty over the coming years to make us even stronger. It is these three areas that we've selected as topics for our focus today. We have both established and seasoned experts and young up-and-coming faculty working in various fields to bring fresh ideas to this topic. You're going to now hear from them. We should remember that these global challenges were not created in a short time, nor will they be solved quickly. However, I believe we have the top thinkers, researchers, and actors at Duke who know no disciplinary boundaries and are committed to making a significant impact on these challenges over the next decade and beyond.